everybody, welcome. Sorry to interrupt the chatter. First of all, welcome to all of you, and I really appreciate the fact that you've made the effort and you're here tonight for this first ever information evening that we're running with Dr. Gahan Kari to talk about plastic cosmetic surgery. What I'd actually like to say to all of you first of all is congratulations to all of you, because many of you have actually come through a process where you've been through bariatric surgery and now you're at the stage, or you're thinking about it, or it could be something in the future, and hopefully not in the too far distant future, when you do reach your goal weight and you're starting to think about, what am I going to do about all the excess skin? So tonight's your opportunity to find out about that. But I actually can't wait to add up the magical number of the total weight loss for this room combined. So congratulations to all of you, wherever you're at in your journey. It's really a pleasure to welcome you here tonight. I'd just like to actually address our online audience tonight. We're actually really lucky that we can run an event like this for all of you here in our waiting room, but also for people who are at home in their lounge rooms who've tuned in to watch us via our webinar. For those of you who've not met me before, my name's Felicity, and you may already know that this is a place where it's our home, and we're very passionate about what we do here. We've got an awesome team who you may already know, who've worked through with you to get to where you're at now, or where you're on the way to. And tonight's a very different night. So yeah, very exciting, and thank you all for being here, and thank you to our online viewers as well. We do have the chat function working, is that right, David?
Yeah,
so
we have.
If anyone who's watching from home wishes to ask questions, please fire away and we'll attempt to answer them. Either
it's private if they'd like to chat with us. It's
oh, it is private. Sorry, thank you, Melanie.
Yeah, everybody online tonight.
Yeah.
We're not showing the list of people, so it's all anonymous.
Private and confidential. So
they can still ask questions of the presenters,
okay,
and they will come through and talk to them.
All right. So if you do have questions, please fire away, and it's totally confidential, anonymous, and we'll address your questions personally. All right. So yeah, don't worry about the cameras here tonight. This is really just for those who are watching us from home. I'd actually like to start with introducing you to a very special lady who's been working here as a bariatric nurse for quite some time now, but she's actually expanded her role in the last few years to offer injectable procedures for patients, and there's a number of reasons for doing that. But probably the best thing for me to do is to introduce to you Michelle. I don't know where she's gone actually. Is she far away?
Right here.
Oh yay, Heidi.
Hi.
Come on out. All right. Michelle's, as I said, a registered nurse with many years of experience and a lot of time spent working in a bariatric surgical environment. But tonight she's actually here to tell you all about the injectable procedures and what she does with patients here. Please make her welcome.
Thank you all for coming, and please feel free, if you do have any sort of comment or question, to interject. I can talk quite fast, so just say, I don't understand that, that's fine, okay? So please don't be afraid, I'm a person just like you. So welcome, and really, I guess I'm just here to talk to you a little bit about the injectable side of things of what we do. Now, would you all agree with me that there are some things in life that we just can't control? Would you all agree with me with that? Yeah, excellent, good. Well, I fully agree with that. But the flip side to that is that there are also some things that we can control. And the great thing that I've learned about injectables over my experience here is that injectables offer a unique opportunity to start to control things that we couldn't necessarily control before. So I'll unpack that a little bit for you as we go. But there are basically three elements that we're all exposed to at some stage during our lives. The environment, so there's the sun, the wind, all those sorts of things. The aging process, unfortunately no one is exempt, and that aging process starts at 20, so don't feel like you're left behind there at all. And that starts to affect things like the elasticity in our skin, the volume, all those sorts of things. And of course there's the genetic side of things, the old adage that says you can't choose your family, you can choose your friends, well you can't choose your genetics either. So all those factors we're all exposed to, so it's like a level playing field that we all have. And we all wear life differently on our faces. Okay, so there's nothing wrong with the way that you are. It's just the way that you're living life and the way that you are. And elements like weight gain, weight loss, disease processes, the extent to which we look after our skin, all of those things, plus the 3 elements we talked about before, all contribute to where we're at and the way that we have life appearing on our face. Let's face it, we all look in the mirror and we're probably our own worst critics, are we not? I know I am. I start to look in the mirror and I just turned 40, now 12 months ago I'm 41, but shh, don't tell anyone. And I started to look in the mirror and I thought, oh my goodness, where did that come from? Oh, that's not good. So we're our own worst critics, but in reality, I am who I am, and it's about accepting who we are and loving who we are in the moment. Okay? But the great thing about injectables is it helps to enhance and rejuvenate those things. So my approach when it comes to injectables is not about changing who you are. It's not about altering your appearance. It's about just looking at the canvas and enhancing that. And those areas where you're really struggling with, we can sit down and chat about them and work through that and then see what the plan can be to achieve it. So what are injectables? There might be some people sitting in the room going, I have absolutely no idea what this woman is talking about. Can you please enlighten me? So let me enlighten you on what it is. Okay, injectables are basically things that you inject in under your skin. So there are 2 types. There's Botox. Anyone heard of Botox? Or anti-wrinkle injection, and fillers. Anyone heard of fillers? Okay, in our clinic we actually promote the Allergan product. We believe it's the best product. So they're the 2 products. One's called Botox and one's called Juvederm. So Botox is basically a, well, let's talk technical now, okay? So it's a purified form of botulinum, which is basically a neurotoxin, and it treats muscle spasms. So let's talk in English so it's clear. It's basically something that goes injected into your muscle and it relaxes it so you smooth out the wrinkles. Now, do I look angry? I hope not, because I just had Botox the other week and the idea was that I got rid of that anger, okay? So it's about just softening the lines, and there's 3 main areas that usually you inject Botox in. It's this forehead here, so you know the lines that can happen here, your glabella, which can give you that sort of angry look, and around our, what we call our crow's feet, or these lines around our eyes. Okay, and so they're the 3 main areas. It can be injected elsewhere, but they're the 3 main areas. And it just relaxes it all, stops it moving so you don't get that look of wrinkles. And it also helps to prevent the wrinkles from deepening, okay? Because obviously if you relax the muscle, it can't deepen anymore. Okay, so that's, everyone understand that? That's what Botox is. So then there's Juvederm. And Juvederm is basically a substance made of, it's a hyaluronic acid, which is something found in our body, so it's not sort of a strange thing. It's broken down in our body over time, but it's basically something that goes, injects under the deeper layer of the skin and just helps to create shape, and where we get volume loss, the main areas is sort of across our cheeks, around our eyes. We tend to get heavier down here during the aging process. So those sorts of things, and it just helps to rejuvenate everything. So it's something that sits under and helps to lessen the deeper wrinkles that appear on our faces. Okay, so the results are fantastic because basically it means that you look less tired. You're looking, ooh, is everything all right over there? It's enhancing the way that you aesthetically look at yourself. And the other great thing that these types of treatment does is it does really give you a bit of a self-esteem boost. Because, you know, when you're happy and you're feeling good and you're looking good for yourself, then you tend to be more confident, don't you, in the way that you approach life. And so this certainly does, and I know that there's people in the room that have had that treatment, and myself, I've had, as I said, Botox, and it does, it just makes you feel like, okay, I've saved another 5 years, it's good, I'm looking good. Both products are proven very safe and effective. They're used in small doses, and as I said, they break down over time. So, you know, Botox treatment lasts about 3 to 6 months, depending, and your Juvederm treatments can last anywhere between 6 to 24 months, depending on where you have it and the type of product that you're using. All right. So the next question is, how do you put it in? people want to know that. Unfortunately, the only way to get it in is an injection. Okay, but it's only small, and it's something that gets done with care, I promise you about that. But basically, there's very minimal downtime. In fact, it's something you can fit in your lunch break if necessary. So it's not like you're needing to schedule a big time slot out of your time. It's something we can slot in. There can be a little bit of bruising, but generally it's okay, particularly with the Botox, and the results certainly speak for themselves. And the great thing about the fillers, it's a little bit more complicated procedure, but it has an anaesthetic already included in it. So once you inject, generally that area's nice and numb, and there's no worries with that, okay? Now, unfortunately, we did have a model coming today who has had some treatment, but she had a car accident, so we do wish her well tonight. And she's okay, it's okay, but obviously that shakes people up. But I do have a couple of photos that she's agreed for me to show, so don't feel like I'm putting her out there, okay? Her name's Juanita, and this is basically Juanita. She's a lady who's been on a journey with weight loss. She's actually reached her goal weight and maintained it for the last 12 months. She's loving life and really enjoying where she's at, but she really was feeling a little bit sort of tired and a little bit sort of drawn, and so this is where we started with Juanita. Once again, it's a very subtle change. It's not about changing who she is, it's just about enhancing some of the areas. And one of her concerns was this glabella region, which we talked about, where she had a few wrinkles here, and I think the next shot shows that as well. Okay, and then the next shot shows she was worried about, oh sorry, that's after, it's a bit blurry, is it my eyes, or is it blurry? So that's the before, and then this is a week after the treatment. Okay, and that's her using her muscle, but there's no, obviously no movement there. So you can see it just softens everything. So the next slide actually is about, she's obviously concerned about the heaviness that can come through here over time. And so once again, we treated that with some Botox. And you can see that's her lifting her eyebrows. So once again, great result from that. Very subtle, very simple, and very quick procedure. Okay. The next thing, oh, that's blurry again too, I do apologise. We looked at, she was quite concerned about the lines across here. Now we call them smoker's lines, but she was adamant she's not a smoker and it's not. But, over time, we tend to get those little lines across here. And so that was something that we treated with some Juvederm and some filler, which, that's a before again as well, just to show the lines. I think, keep going. I missed one. That's her cheeks. No, we'll keep, if you go back to, we'll talk about the other area that she really focused on was she felt like she lost a little bit of volume through here, which, tends to age us a little bit. So obviously you can see, is that the first one of those? Yes. Yep, so just go back to the first one. So that's before, and if we go to the next one, you'll actually see this is halfway point. So we actually just subtly put in some filler here and created a nice arch through her cheekbone. It's very subtle, but she was really happy with it. And so the next one, I think, is looking again before. Keep going. And there's afterwards. So you can see we've created a nice little volume, and she was stoked with that. And once again, it didn't change her. It didn't change who she was, but it certainly enhanced what she had already got there on her beautiful canvas. She's a lovely lady, and that's the 2 weeks after treatment. So she was very happy, and virtually no downtime. But basically the treatment took about 45 minutes, and she was back at work the next day. Okay, so that's what can be achieved. Really subtle, and there's obviously a lot of other areas that can be treated. It's all about what you want, because we are very much about holistic approach here in our clinic. We like to look at all areas, and being based predominantly a weight loss clinic, obviously a lot of our patients over time as they lose weight tend to lose a lot of volume, and so this really service provides an opportunity for patients to continue to evolve as they are evolving with their weight loss journey, because it's not just about the weight, is it? It's about, the holistic approach. And so this has certainly been an area of growth, and obviously we've got a lot of other clients now that are accessing just the injectable service. We offer part of that holistic approach is offering a full beauty therapy, and our beautician, which is that beautiful lady over there, Kay. You better come out so that people at home can see you, Kay. this is Kay, and she's recently joined our team, and we're very blessed to have her as part of our team here. But she has, these hands are just beautiful. The most amazing experience you'll ever have is to have a facial or a massage with Kay. And she does it with care, with professionalism, and with plenty of experience. So we're very grateful that she's part of our team. And if you want to chat with her about what she does offer, then please feel free to approach her after. She'll be available for that. So thanks, Kay. Also, as part of, I mentioned earlier about one of the influences is looking after your skin. We look after our skin by trying to have a healthy, balanced diet. We drink plenty of water. We try and put sunscreen on. We moisturise. So those sorts of things are really important. And so what we carry is an ASAP range. I'm not sure if you've heard of the product. It's an Australian-based product. And we're fortunate to have Karen in the room, who's actually the area manager for ASAP, has come along tonight. But the reason that we carry our skincare is a cosmeceutical, so it offers a very scripted prescription skincare, so it's particular for your skin type with assessment, and obviously offers a way to reduce pigmentation, increase moisture, all those sorts of things. I'm not a beautician, but it's all part of the service. And so Kay's also trained and expert in the ASAP range too, so you can chat with her about that. All right, I think I've covered everything. Is there anything before I close that anyone had any questions about, or didn't feel I covered anything? Hopefully it's not too much information all in one go. No? Excellent. Okay. So as I said, here at WLSA Aesthetics, our approach is all about enhancing you. So we're not about changing you. We sit down together, we look at the areas that you're worried about, we put a plan together, and we can work them towards the results that you're wanting to achieve. So if you do have any questions or concerns, or wanted to book a complimentary session with me, that's quite okay, and I'd love to chat with you afterwards. So I'm going to hand you back to Felicity. So thanks very much for your time.